Hello everyone, my name is Dr. Zainab Mudasiru, co-founder and clinical lead of BabiesMatter Medical Center based in Lekki. We're an advanced neonatal care hospital, and our specialty is looking after premature babies from 25 weeks gestation to 37 weeks gestation. So I'm just going to say a little bit about experiences of both the parents and us, the staff, when it comes to the journey of these premature babies. So I'm going to start with the parents. So for the parents, it's a very, you see, I tell all the parents that come, have a premature baby on the unit, especially those with babies less than 30 weeks gestation, that it's a roller coaster. It's going to be a roller coaster ride. So there'll be up days, there'll be down days. And that's just the way their journey is. So you can imagine a lot of them obviously very upset because babies were born early. That was never their plan. So they're very upset. And I find with a lot of the mothers, they carry this guilt. They feel that they've done something wrong, and that is why the baby came out premature. So we have to sort of just keep just reminding them that it's nothing they've done, and they shouldn't feel guilty. But you can say that, but they still have all these emotions. It's very hard for them. They come to hospital, see their baby, and they have to go home again without their baby, day in, day out. And babies, especially the ones born at 25 weeks gestation, they can be here for 3.5 months, stay. So it's a lot on the parents, and even the fathers. A lot of us, we forget about the dads. They have feelings as well. A lot of them as well. They may not voice it or try to show it because they need to show they're the man, but I can see through them sometimes, and that fear is also there, that worry is also there, for the lives of their babies. So I think it's for that side of things, the parents, it's hard, it's very hard, it's very demanding, it's very challenging, and I keep telling them they need to be patient and they need to be strong. Those are two words I use for them. You need to be patient and you need to be strong if you're going to get through this, And eventually when they're going home, because all that fear out the window, all the guilt out the window, the joy that you see in them, their faces, their persona is just beautiful to see. So that's, and then also I was going to add actually for the especially more the mothers, I'm thinking, I think we're actually thinking about this, doing this in BabiesMatter Medical Center, getting someone for them to talk to, like a professional for them to talk to, because I need milk from them. And if they're going through all these emotions and feeling down and upset and, sometimes even depressed, depression can set in. It affects the milk supply as well, So something we're thinking of starting to do now is getting them to get a professional and just offer it. They don't have to, take the offer. If they want to, they can talk to a professional just about how they're feeling and, just to help their psychological and mental state, really. So that's that part of things. Now the second part, where obviously I'm on that side, the staff. So for us, believe it or not, these babies that come to us, we develop feelings for them. For us, it's not just a job looking after these tiny babies and then we have no attachment, and no, it's not like that at all. The doctors, the nurses, the healthcare assistants, we all develop bonds with these babies, especially the ones that stay with us for longer. We develop bonds for them. We love them. We actually grow to love them like they're our babies. So for us as well, when we see if it's a down day, we feel it as well. We also get upset. Our emotions are also all over the place. Believe it or not, when they're well, we're happy, we're joyful. When they're not so well, we're a bit down. And of course, we do everything in our power, with God helping us, to make the right decisions for them, so that we have the right and good outcome for them. So for us as well, it's not an easy process. I've seen many of my nurses cry in the past when a baby's not very well. It's emotional for us as well. And of course, our greatest joy is the day they're going home, especially the 25, 26, 27 weekers when they're going home. It's where everybody's so happy, joyful. You can see the atmosphere just, in the whole unit. It's just beautiful. And also just to mention, something else we're going to start to do as well is, which these premature babies need, is involve a professional, qualified speech and language therapist, not for any speech or anything, for the feeding part of things as well, because these premature babies also sometimes need a bit of extra input from we call them the SALT team, for just to help with their feeding and advice with feeding and things like that. And so we're collaborating with a speech and language therapist, and also even after the babies have gone home, the parents have the option of also using their services as well, which would be very good. So I did my training in the UK. I did a lot of my neonatology in the UK. So when I got back to set up BabiesMatter with Dr. Dosaku, the other co-founder. We opened our doors 1st of November 2023. Now, when I first got back to Nigeria, I kept hearing the same thing. Viability in Nigeria is from 28 weeks and above. Less than 28 weeks. Many places that look after babies, they don't bother really. I mean, so not all. Some places they do, but a lot of places, for them, viability is 28 weeks and above. And I thought, no, we can do better than that. So when we first started BabiesMatter, what Dr. Dosaku and I did, we made sure we sat down and we sort of outlined for these babies to survive, because we planned from 25 weeks and above. The more premature they are, the more immature they are, the more challenging the care is for them. You can imagine, everything is so immature in their bodies. So we sat down and outlined technology is our friend. The equipment we need, medications, the type of staff we needed. So we sat down, we outlined all these things. So with technology, that's easy. You can, now in the world, you can get anything you want really. So we sat down, got all the equipment we needed. Medications, again, we have to be careful because there are lots of fake things out there, So again, getting from a reputable pharmacy. Again, some medications I still cannot get in Nigeria, and I have to bring them in from the US and the UK till today. So getting things from outside Nigeria, we had to do that. For the type of care we wanted to give, the type of standard we wanted, we had to get them from abroad. We still do. Staff, very important. So me as a doctor, I come, I see the babies, I review them. If they're unwell, I come, I see them, I review them. I'm not there all the time with the babies. The nurses, they're the ones there with the babies 24/7. They're looking after them, monitoring them, changing nappies, giving medications. So, sorry about that. So they are the ones that paramount. So I needed good staff. I needed staff that I could trust, rely on. So I handpicked my staff. So did lots of interviews. I handpicked my staff. And teaching, training, a lot of sweat, some tears sometimes, but I trained them, I taught them, and they're just fantastic. They're fantastic, so important stuff as well. So all these things, so technology, getting the right medications that are real medications, and the right stuff. Three things I think has made the difference for these babies. Okay, and regarding the question about how the government can help, I think collaboration is the key. I think collaborating with the private sector is the key, in the sense of teaching and training of staff. I think very important. Like I said, staff, teach skills, the skills of the staff, especially the nurse, is very, very important. So I think teaching and training, like the collaboration, teaching and training, would be really, really good. To increase some knowledge and skills of the staff looking after these babies really in the public sector. I think that'll be a huge way to improve things generally. And also, I just have one more thing to add, please. I really need to say this, very important. For the best outcomes for these babies, especially the more premature babies, the neonatal team should be present from the time the baby is born. Now, sometimes that could be difficult. You can have an expedited delivery and the baby just comes out without any warning. I've had that in the past. I had a baby born, I think it was a 25-weeker. So we're based in Lekki. The baby was born in Ikeja. What they did the right thing. They sent a nurse, put the baby in, I don't think they had a transport incubator, but they just tried to keep the baby nice and warm, put some oxygen on into their type of vehicle they had, with a nurse and with a saturation monitor, and they just raced to us. And guess what? That baby has gone home, and it's absolutely a 25-weeker, and it's absolutely fine. But they did the right thing. They didn't wait for 4 hours or 6 hours, saw the baby was really, really sick, and then, oh, okay, let's send somewhere else. No. From the time the baby was born, they made a decision to send the baby to us. So the baby was with us, I think, within an hour and a half of delivery, which really saved that baby's life, Now, so sometimes, babies come out quickly. There's nothing you can do. Please just give us a call. And because we have a transport incubator, we have a team on standby, we have the ambulance on standby, we will come and get the baby as fast as we can. But preferably, if a baby is going to be born quite early and you're not happy to look after a baby born that early, if you give us a call, we can be there and be present with all our equipment, everything we need at the time of delivery. And as soon as the baby comes out, we just take hold of the baby, because there's a phrase, we call it the golden hour, where what is done in that first 1 hour of the baby's life could determine either life or death, or even if life, the type of outcome that baby will have, so it reduces the morbidity and mortality of these babies. Very important, please. Thank you. So I'm calling on the relevant team, the obstetricians. Sometimes you have some notice that a baby will be born premature, such as mom is bleeding or her membranes are ruptured, quite early, and a baby potential delivery. Please, you can give us a call, and we can have a plan, and we can make sure the baby has the best outcome, which is what we both want, and parents want as well. And lastly, very excited, World Prematurity Day is coming up. It's on November 17th every year, which is when we celebrate all the babies that are born early throughout the world. It's a celebration all over the world. Globally, about 1 in 10 babies is born premature. But we think in Africa, and let me talk about Nigeria, it's more than that, actually. It's more than that. Many premature babies are born out there, and it's just not a part of the statistics. So we know it's more than that out here. So we invite all our first one we did was last year when we were 1 year old. And we invite all our premature babies' parents. The ones that have gone home, they come with the babies. The ones that are still on the units, the parents still come with family members. Just come and celebrate our warriors. We call them our warriors. We call them tiny but mighty warriors, courageous babies. All they go through, and they fight to survive. And we just celebrate. We celebrate them. We celebrate their parents as well. Okay. So on that note, I want to say goodbye. Thank you.